Welcome to today's episode. In this video, we'll be diving deep into one of the most dangerous and widespread viral illnesses in the world. Dengue fever. From its roots in ancient history to modern-day treatment advancements, we're covering everything you need to know. So, let's get started.
Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high fever and flu-like symptoms. The severe form of dengue fever, also called dengue hemorrhagic fever, can cause serious bleeding, a sudden drop in blood pressure, shock, and death. Every year, millions of people contract dengue fever across the globe. Southeast Asia, the Western Pacific Islands, Latin America, and Africa are the regions where dengue fever is most prevalent. However, the illness has been moving to other regions, with isolated outbreaks reported in southern U.S. states as well as Europe. Vaccines against dengue disease are being researched. For now, avoiding mosquito bites and taking action to lower the mosquito population are the best approaches to prevent illness in places where dengue fever is prevalent.
1. What is dengue fever?
The dengue virus, a fly virus, is the virus that causes dengue fever, which is spread by mosquitoes. The Aedes mosquito, particularly the Aedes aegypti species, is the main vector of its transmission. Millions of individuals worldwide are afflicted by the illness, with tropical and subtropical regions being the most affected. However, what really occurs when a person has dengue fever? Let's examine its signs and how it affects the human body.
2. The history of dengue fever.
Dengue fever has ancient roots. Despite the fact that it may appear to be a contemporary problem, more than 2,000 years have passed since the first occurrences of an illness similar to dengue were documented. Texts pertaining to ancient Chinese medicine from the Jin dynasty, which spanned from 265 to 420 AD, spoke of a water poison that produced symptoms resembling dengue fever and was probably spread by flying insects. Let's fast forward to the 18th century, when recorded accounts of Spanish colonies in the Americas began to mention dengue fever. Dr. Benjamin Rush coined the term dengue in 1789 to characterize a fever that resembled modern dengue and was so severe that it was nicknamed backbone fever because of the severe agony in the joints and muscles. As trade routes and towns grew as a result of globalization, dengue epidemics became increasingly common by the early 20th century, giving mosquitoes the ideal conditions for hatching. Following the tropical and subtropical regions where mosquitoes flourished, the virus spread around the world.
3. The dengue virus. How it works.
Knowing the mechanism of the virus is essential to comprehending dengue fever. DEM1, DEM2, DEM3, and DEN4 are the 4 different but closely related serotypes of the dengue virus. Though infection with one serotype only confers immunity to that particular kind, any of them can cause the disease. This implies that an individual may contract dengue fever up to 4 times in their lifetime. The virus enters the bloodstream after an Aedes mosquito bites a person who has the infection. From this point on, it avoids the body's immunological defenses by replicating and migrating via the lymphatic system. After an incubation period of 4 to 10 days, symptoms usually start to show up.
4. Symptoms of dengue fever.
The symptoms of dengue fever might vary in severity. Some people may have a wide range of health problems, while others may not exhibit any symptoms at all. Among the traditional symptoms are sudden high fever, often reaching 104.40°C. Severe headaches, pain behind the eyes, joint and muscle pain, leading to the term backbone fever. Fatigue and exhaustion. Skin rash, which typically appears 2 to 5 days after the onset of fever. Mild bleeding symptoms like nosebleeds or gum bleeding. For most people, dengue fever symptoms last about a week, but in severe cases, it can develop into a life-threatening condition known as severe dengue or dengue hemorrhagic fever. Severe dengue symptoms can include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, blood and vomit or stool, fatigue and irritability. Severe dengue can result in internal bleeding, shock, and even death if treatment is not received. Early diagnosis and treatment are therefore essential.
5. Causes and transmission of dengue fever.
The primary source of dengue fever is an infected Aedes mosquito bite. Because these mosquitoes prefer warm, humid climates, dengue is most prevalent in tropical and subtropical areas. During the day, the Aedes mosquito is most active, especially in the early morning and late afternoon. Mosquitoes can breed in any container or object that holds water, including flower pots, abandoned tires, and clogged gutters. This is because they feed on stagnant water. A mosquito that has contracted the dengue virus can bite humans and carry the illness for the rest of its life. The fact that humans are important to the virus's cycle of transmission is fascinating. An uninfected mosquito can become infected and spread the virus to other people if it bites a person who is virus carrying. It is challenging to contain outbreaks because of this cycle, particularly in locations with high population density. Complications of dengue fever in pregnancy.
Dengue fever during pregnancy has the potential to result in miscarriage, poor birth weight, or early delivery. Preventing dengue during pregnancy is crucial for the safety of both the growing fetus and yourself. 6. The global impact of dengue fever.
Currently, dengue fever is a problem in more than 100 countries, with an estimated 390 million cases reported annually. Approximately 96 million of these cause clinical symptoms. Among the worst hit areas are Southeast Asia, the Pacific Islands, Latin America, and the Caribbean. Healthcare systems bear an enormous burden in regions where epidemics are still occurring. Dengue patients frequently overcrowd hospitals, particularly during the rainy seasons when mosquito numbers are at their highest. Controlling dengue has become increasingly more challenging in tropical countries due to urbanization and population expansion. Cities that lack access to clean water, handle trash poorly, and have poor sanitation are particularly vulnerable because they offer mosquitoes an abundance of hatching sites.
7. Diagnosis of dengue fever.
Given that the symptoms of dengue fever frequently mimic those of other viral diseases like the flu or malaria, diagnosing the disease can be challenging. To confirm the diagnosis, medical professionals usually use a mix of laboratory testing and clinical symptoms. Blood tests that identify the virus in its early stages of infection include the polymerase chain reaction PCR test and the Dengue 1 antigen test. Later on, medical professionals could employ serological testing to pinpoint the antibodies the body has created in reaction to the infection.
8. Treatment and management of dengue fever.
Sadly, there isn't a specific antiviral medication available to treat dengue fever. Treating the symptoms as soon as they arise and providing supportive care are essential to managing dengue. The goal of treating mild cases is to control pain and fever. Acetaminophen is frequently advised by doctors to lower fever and relieve pain. Drinking enough of water is essential since dengue fever and vomiting can lead to dehydration. Patients are advised to stay well hydrated. In more serious situations, intravenous IV fluids might be required. Hospitalization is necessary for severe dengue in order to treat consequences such as hemorrhage, dehydration, and organ damage. In certain instances, the patient needs critical care and blood transfusions to survive.
9. Prevention and control of dengue fever.
Prevention is essential for dengue because there isn't a known cure. The following are some strategies to avoid contracting dengue fever. 1. Avoid mosquito bites by wearing long sleeve clothing, using insect repellents, and sleeping under mosquito net. 2. Eliminate mosquito breeding sites by ensuring there is no stagnant water around your home. 3. Support local mosquito control programs, which may involve fogging and larvicide treatments. There is a dengue vaccine called Dengvaxia that has been licensed for use in a number of nations. But since it can raise the risk of severe dengue in those who have never been exposed to the virus, it is only advised for those who have already had dengue infection.
10.
Dengue fever is becoming an increasingly serious hazard to international health, particularly as urbanization and climate change give the Aedes mosquito greater habitats. However, we can lessen the effects of this illness by early detection, prevention, and therapy.
Appreciate you seeing the video for today. We hope this information was helpful to you. If so, kindly like, comment, and subscribe to our channel in order to receive more advice and insights about health. Please leave a comment below if you have any queries or suggestions for topics we should
subscribe to my channel.